Welcome to this explainer. Look, today we're tackling something that is massively complex and honestly almost totally misunderstood, the reality of jail healthcare right here in Alabama. Whether you're deeply entrenched in public policy or you just want to know how our local systems actually run, you are absolutely in the right place. We're going to unpack why the stuff happening behind those locked doors is actually tied directly to our broader public safety. We'll look at the immense systemic pressures, the crazy daily medical hurdles, and why, at the end of the day, this literally impacts you and your community. So let's kick this off with a pretty massive shift in perspective. What happens when a county jail accidentally becomes the largest healthcare facility in town? To really grasp this, we've got to completely reframe our thinking. We normally just view jails as detention centers, right? But the reality is, they've morphed into these severely underfunded, makeshift clinics operating under incredible pressure, handling everything from acute psychiatric breaks to really complex chronic diseases. Okay, let's quickly map out our agenda here. We'll start with the healthcare pressure cooker, move into everyday medical challenges, touch on mental health and addiction, look at the overcrowding multiplier, and then finally go beyond the jail walls. All right, kicking things off with Section 1, the healthcare pressure cooker. Let's look at the systemic root causes creating this exact environment. So jail administrators in Alabama are up against some truly massive systemic forces. These are not just one-off problems. Imagine older facilities, buildings literally designed with zero dedicated medical space, suddenly forced to act like full-on clinics. Add to that severe court backlogs. People are stuck there way longer than these buildings were ever meant to hold them. And then you have the rural staffing shortages. It is incredibly tough to recruit nurses, mental health pros, and doctors out there. The result? Jails are housing much sicker people for way longer with just a fraction of the resources. Moving right along to Section 2, everyday medical challenges. Let's see how all those systemic issues actually play out on the ground, day to day. Think of the medical care inside a jail as this really fragile timeline. Every single step is a potential failure point. Right at the door, at intake screening, staff have to instantly spot untreated injuries or withdrawal symptoms. Then comes medication verification, basically a scramble to figure out exactly what life-saving prescriptions someone needs. And finally, chronic disease management, where they're handling long-term stuff like diabetes. If any one of those links breaks, well, the whole system just collapses. And when you stack up the sheer volume of these daily medical duties, it is staggering. We're talking about managing delayed intakes, keeping diabetic patients stable, filling huge gaps in mental health care, dealing with severe substance withdrawal, and somehow controlling infectious diseases in incredibly tight quarters. Even limitations on basic dental and vision care have a huge impact. It's basically the entire burden of a traditional hospital just squeezed into a concrete block, which creates this wild, high-stakes balancing act. On one side, jails are locked into super strict security protocols. They have to carefully obtain outside records and cross-check every single prescription. But on the flip side, they are fighting intense medical urgency. While the staff is busy doing all that administrative checking, the clock is ticking to prevent life-threatening things like seizures or insulin crashes. It's a constant tug-of-war between doing it safely and doing it fast. That brings us to Section 3, mental health and addiction. We're going to take that baseline problem and agitate it even further. Look, mental health care in these spaces isn't just some extra perk. It's a core function. A lot of folks enter custody in active psychiatric distress, dealing with severe depression, trauma, or psychotic disorders. And honestly, even without a pre-existing condition, just the shock and trauma of being arrested can trigger a massive crisis. Because of this, suicide prevention and rapid crisis intervention become absolutely critical everyday operations. We are literally talking life and death here. And there is a massive gap here between theory and practice. Clinically speaking, these individuals desperately need psychiatric meds and licensed professionals. But the operational reality? Those pros usually aren't in the building 24/7. So the first line of defense actually falls on the correctional officers. Suddenly, custody staff are the ones tasked with spotting clinical warning signs, which makes specialized training absolutely crucial to prevent a tragedy. To make matters even more complex, you have substance withdrawal. Coming off alcohol or benzodiazepines is incredibly dangerous and can start within just hours of someone walking into a cell. If they don't have immediate access to evidence-based treatment behind bars, which often needs to include medication-assisted treatment, those withdrawals can rapidly turn into fatal medical emergencies, like really severe seizures.
Okay, Section 4, the overcrowding multiplier. We know the ecosystem is fragile, so let's see what happens when it gets pushed to the absolute breaking point.
We really have to ask ourselves, what happens when the sheer volume of medical needs blows right past what a facility was ever built to handle? Imagine the jail we just talked about. Already struggling with short staffing and incredibly complex medical cases, now pack it with way more people than its infrastructure can safely hold. The math just stops working.
In military terms, overcrowding is what you call a force multiplier. It's a factor that dramatically worsens an already bad situation. It exponentially speeds up the spread of infectious diseases. It delays crucial diagnoses because the staff just have too many patients to see. And from an administrative angle, it drastically shoots up the legal exposure and financial costs for the counties trying to run these places.
Which leads us to our final stop. Section 5, Beyond the Jail Walls. Let's look at some real solutions and why this actually impacts all of us. Now, these solutions aren't just pie-in-the-sky ideas. They drive real, measurable outcomes, bringing in electronic health records and telemedicine. That directly cuts down on diagnostic delays and actually helps bypass those rural staffing shortages we mentioned earlier. Expanding substance use treatment inside prepares people for reentry and drastically lowers the chance of relapse. Better suicide prevention training empowers officers to escalate cases before it's too late. And setting up faster medication verification stops life-threatening gaps in care dead in their tracks. But here is exactly why you need to care about this, even if you never interact with the justice system. Inmate healthcare is a public health issue. Almost everyone who's incarcerated will eventually return to their community. They're returning to our neighborhoods. If they leave custody with untreated illnesses, unmanaged mental health issues, or broken medication routines, well, those problems follow them right home. And ultimately, that puts a massive strain on our local ERs, our community clinics, and our families. And that brings us to the core thesis here. A jail system that catches illness early, treats it consistently, and plans for a person's release is much more likely to protect both human dignity and our public resources. Fixing jail healthcare isn't just about ticking off some compliance boxes, right? It's a highly practical, urgent necessity. Doing it right makes sure that a short-term stint in jail doesn't become a lifelong sentence to worse health. So I'm going to leave you with this final thought. How will prioritizing healthcare behind bars ultimately transform the health, safety, and economic stability of your own town? Because the complex realities of jail healthcare don't just stay locked behind concrete walls. They are deeply, deeply intertwined with the well-being of our own neighborhoods. When we fix the system inside, we build a much stronger system outside. Thanks so much for joining me for this explainer. Keep asking the hard questions, and I will catch you next time.